All right, team, listen up. We've got a patient presenting with necrotizing fasciitis, cold compression therapy, and duodenal lymphocytosis. What are we thinking here?
It could be a severe infection causing tissue death with necrotizing fasciitis, but the cold compression therapy seems contradictory.
Maybe there's an underlying autoimmune condition affecting the lymphocytes in the duodenum. It could be related to a systemic issue.
I'm leaning towards a rare genetic disorder that affects the bones and soft tissues. Could it be multicentric carpotocell osteolysis syndrome?
I agree with Randall. The symptoms seem to align with that diagnosis.
Damn it, stop wasting time. It's multicentric carpotocell osteolysis syndrome. We need to act fast. Prepare for lithotomy. It's risky, but it's the only way to save this patient's life. Tracy, I believe the best course of action for my patient is to perform lithotomy. The symptoms point to multicentric carpotocell osteolysis syndrome.
Hawks, are you sure about this diagnosis? Have you considered other possibilities?
Of course I'm sure. I have years of experience in this field, Tracy.
I'm not doubting your expertise, Hawks, but let's not forget that you have a record of being wrong in the past. We need to be cautious before moving forward with such a procedure.
This is different, Tracy. I know in my gut that this is the right approach. Trust me on this one.
I understand your confidence, Hawks, but let's take a step back and review all possible options before making a final decision. Let's not rush into anything.
It's worse than we thought, Leslie. The lithotomy procedure only worsened the situation. Hawks is going to be furious when he finds out.
Frank, let's focus on the patient first. We need to stabilize them before worrying about what Hawks will think.
I know, but we can't ignore the fact that this was a critical mistake. How do we break the news to Hawks that we misdiagnosed multicentric carpotocell osteolysis syndrome?
We'll figure it out, Frank. Right now, let's make sure our patient gets the care they need. Hawks will understand once he sees we're doing everything we can to fix this.
I don't understand. You nearly killed the patient with your incompetence? Wrong lithotomy, wrong diagnosis? Are you all even qualified to be diagnosticians?
But Dr. Hawks, we thought...
Maybe it was just a mistake. We can still find the right diagnosis.
I agree. Let's work together and figure this out.
I think we should consider all possible options before jumping to conclusions.
You idiots. Do you want to play doctor without any clue what you're doing? I'd rather trust a monkey with a stethoscope than any of you. I'm out of here. Figure it out yourselves. So, Johnson, how's everything going outside the hospital? Any exciting plans for the weekend?
Oh, just the usual. Trying to catch up on some rest and maybe finally finish that book I started a month ago.
Sounds nice. I've been completely absorbed in this puzzling case lately. The symptoms just don't add up.
I get it. Work can really consume you sometimes. But hey, you'll figure it out. You always do.
Wait a minute. I think I know what's causing the symptoms. I need to go check on my patient right away.
Oh, okay. Well, good luck with that. I guess I'll see you later then, Hawks.
Cleaving abruptly. Thanks, Johnson. I'll catch up with you later. Bye! Sorry for the intrusion, but I had to act fast. We're dealing with a whole new ballgame here.
Hawks, you can't just barge in here like this. Where is your protective gear? You're putting everyone at risk.
This is unacceptable, Hawks. We have protocols for a reason. You can't just disregard them.
What's gotten into you, Hawks? And what do you mean by a new diagnosis? Multicentric carpotocell osteolysis syndrome is a well-known condition.
I've done my research, Frank. Multicentric carpotocell osteolysis syndrome doesn't fit. It's germ theory of disease causing these symptoms.
Germ theory of disease. Are you serious, Hawks? What's the prognosis then?
The prognosis is clear, Randall. With the right treatment, we can contain and control the spread of the disease. We have to act fast. Tracy, I finally cracked the case. It was a rare case of Madeleine's disease all along.
Congratulations, Hawks. That's great news for the patient.
Yeah, well, if I didn't have a team of complete idiots to deal with, we would have gotten to the right diagnosis a lot sooner.
What do you mean by that, Hawks?
You were the one who initially diagnosed it incorrectly.
Well, you know how it is. Sometimes things get lost in translation within the team.
No, Hawks. You need to take responsibility for your own mistakes. You can't just blame others.
Fine, whatever. I'm out of here.